Hello everybody, I'm Dr. Mo. Today our lesson is about hypercortisolism. It's Cushing's syndrome. Let's look at the endocrine systems. Consists of several glands located in various part of the body, special gland, hypothalamus, pituitary, thyroid, parathyroidus, adrenal, kidneys, pancreatic, ovaries, and testes. Okay, look at the pituitary gland. Pituitary gland is small gland located stalk hanging from base of brain. It is the master gland. First primary function is to control other glands. It produces many hormones. Secretions is controlled by hypothalamus in base of brain. It have two axes. The one anterior pituitary and posterior pituitary. Their structural function is different. First, we look at the anterior pituitary. It can secrete cellularly stimulate hormone, for short TSH. Second is adrenal corticotropic hormone, for short ACTH, stimulates the release of adrenal corticotropic hormone. Its growth hormone GH, follicle stimulate hormone FSH, luteinization hormone LH, prolactin PRL. Allantocyte stimulate hormone FSH. Look at the adrenal gland. This small gland located near the kidneys consists of outer cortices, pits, inner medulla, 水质 Adrenal medullars secrete the adrenal medulla the catecholamines, hormones, non-repinations, and impinations. Impinations and non-repinations is prolonged and intensifies the sympathetic nervous system's response during stress. Adrenal cortex secrete aldosterone, for short ALD. It is can regulate electrolyte potassium, sodium, and fluid homeostasis. The second cortisol is glucocorticoids. Its effect anti-inflammatory, anti-immunitary, and anti-allergy effects, increasing blood glucose concentrations. It can secrete adjustments, stimulate secret drive in females. Look at the journal contents. Secret glucocorticoids account for 95% of adrenal cortex hormone productions. Increase the level of glucose in the blood, released in response to suggestion, induce and serious infection, and lack the hormones from the adrenal medullus. Adrenal cortex secrete mineralocorticoids (ILD). It works to regulate the concentration of the potassium and sodium in the body. This picture. Look at the picture. The hypothalamus secrete CRH, stimulate P2P tumorous ACTH. Then ACTH stimulate adrenal secrete cortisol. Through the negative feedback CRH. The balance is ACTH increased secreted cortex is increased, then through the negative feedback ACTH decreases. If the ACTH decreased, then the cortisol is increased. So the negative feedback ACTH increased. If the cortisol increased, then ACTH decreased. So the negative feedback, the cortisol is decreased. On the contrary, if the cortisol is decreasing, then ACTH increased. Then the cortisol is increased. When good glanders go bad, this waters over the endocrine systems. Abnormal adrenal function. First, hyperadrenalism 功能亢进。The first excesses activity over the adrenal gland, Cushing syndrome and disease. And the ocular normocytoma. It can be habitation. The second is on the contrary, hyperadrenalism. It is adrenal insufficiencies, inadequate activity over the adrenal gland. The clinic is Addison disease. Let's study the hypercortisolism. First, definitions. Which manifestation of the excess cortisol commonly due to suppressed as physiologists dose of glucose corticoid drugs and rarely due to spontaneous production of excess corticosteroids by the adrenal cortex. There can be clinic features. Multiples in adults and females. Cushing syndrome result from increasing the adrenal cortico's secretion of cortisol. Look at the etiology and pathophysiologies. First, ACTH-dependent causes. ACTH secretions pituitary tumor. It can be Cushing's disease. It has 70% to 80%. It has bilaterally adrenal hyperplasia. It can secrete large amount of cortisol. It can be hypothalamic dysfunction. This picture is the Cushing's disease. Pituitary ACTH tumor due to the Cushing's syndrome. Tumor stimulate secrete the lot of ACTH is the adrenal prime hyperplasia secrete lots of cortisol. ACTH independent causes primary adrenal cortex tumor. The second is the general adenomas or adenoma carcinomas. Secrete numerous cortisol autonomous ACTH independent adrenal corticones outside the tumor and objecting shreve. This picture is the tumor is in the outside. Can secrete lots of constants and feedback the pituitary and ACTH stimulus adrenal. The third is the ectopic ACTH secretion. Small cell carcinoma of lung. Endocrine tumors of forgot origins. Ecumicus carcinoids. Alert cell tumors essentials is non-pituitary tumors produce ACTH. Adrenal corticals proliferate. It can stimulate secretions numerous corticosteroids constitutes. It can be lung cancer, salmon's cancer, and pancreatic cancer is common. The lung secretes lots of ACTH, stimulate adrenal secrete lots of cortisols. The last is topic CRH syndrome. The tumor from other side produce CRH. It can stimulate pituitary secrete numerous ACTH. Adrenal corticals secrete numerous corticosteroids. ACTH independent of causes. It is bilateral, small, nodular, hyperplasia 双侧小结节样增生 or small nodulars dysplasias 小结节性发育不良。This the tumor ectomic CRH stimulates pituitary ACTH, then stimulate the adrenal secrete the cortisol. Then look at the effect of the glucocorticoids. The first effect on metabolism. The third effect on immunological function and inflammatories. The third effects on musculoskeletal and connective tissues. The fifth is effect on fluid and electrolytes. Homeostasis. And it used neuroscience, actuators, and behavioral effects. Gastrointestinal effects, development effects. Then look at the pathophysiology and clinical manifestations. The first is the lipid metabolism, fat mobilizations, and synthesis both speed up. The fat redistribution. It can in the central obesity, move face, buffalo hump. Look at this picture. The patient is move face. The central obesity. This is the buffalo hump. Look at the hump. Like the buffalo. Then the proteins metabolism disorders. Proteins decomposition increased. Then the syncrete H2 play particularly pupil striae 指纹. Look at the abdominal striae. The striae, the leg, it is inner side striae. Look at this. Then it can be glucose metabolism disorders. It can promote gluconeogenesis and antagonisms insulin. It can be the IGT, impaired glucose tolerance, diabetes mellitus, and the electrolytes imbalance, surgeon's storages, discharge, potassium, edemas, hypokalemias, hypertension. Decrease the anti-infective abilities. Then affect the hematopoietic systems changed. It can stimulate myelopressures. It can affect sexual dysfunction. Excessive secretion of adrenals promoting hormones decreased. It can be menstrual irregularly, strange, acne, masculine. Look at the patient. The face is pressureless, is red. It can be neurological and psychiatric disorders. Skin pigmentations, effect on musculoskeletals and connective tissues. It can be have osteoporosis. Look at the persons. It is clinical manifestations. Cushing syndrome characterized is by trunks obesity, moon face, buffalo hump, acne, hirsutism, abdominal striae, hypertension, psychiatric disturbances. Is also tuberculosis. The female's patients, it can be a mammalian. 毕竟 library findings IGT diabetes mellitus leukocytosis hypokalemia 24 hours urine free contents is high. Normal is 20 to 90 micrograms per deciliter. If the Cushing is greater than 150 micrograms per deciliter, then cortisol's circadian rhythms disappear. Cushing syndrome's characteristics. Sleeping's blood-free content is more differs. When blood-free contains greater 1.8, the sensitivity is the 100%. Let's look at the left picture. This is normal. In the midnight, the contents is the lowest. In the morning, at 8, the contents is highest. At the afternoon, the contents is middle. Look at the right. The Cushing's patients in the all times it is higher. Look at the cortisol's circadian region disappear. Text for hypercortisolemia. One milligrams dexamethasone 地塞米松 for short DX suppression text. Blood-free contents is 3.6 to 7.2 microgram per deciliter. Normal is less than 5 micrograms per deciliter. The quotient is greater than 10. Blood-free cortisol is less than 1.8 can include the cushions. Parameters with high forces persistent rate. So then we use the 2 milligrams DSA special test. Test the hypercortisolemia. Large dose DMs is 8 milligram suppression text. 大地塞米松抑制实验 24 hours urine and blood-free contents as controls. As dexamethasone is 2 milligrams every 6 hours. Eat 2 milligram dexamethasone in 2 days. Measures 24 hours UFC and blood-free cortisol every day. Pituitary inhibition rate greater than 50%. Adrenal and ectopic inhibitions rate less than 50%. Look at the picture. Cushing's disease is the ACTH. Primary ACTH is the middle's higher. The adrenal adenomas is lower. The hepatic ACTH is the highest diagnosis. Clinical manifestations, library findings, blood urine cortisol increased. Circadian's region disappears, cannot be suppressed by low dose DX images antigens. They are required. Remember. Causes, diagnosis, Pituitary Cushing's disease. It looked insidious onset, slowly develop. Pituitary CT MRI indicator pathological changes. Both side adrenal middle hyperplasia. Causes diagnosis: adrenal adenoma or carcinoma. Adenomas symptoms appear gradually without the pigmentations. Carcinomas progress rapidly. Adrenals excess abuse, low blood ACTH. Cortisol cannot be suppressed by large dose DX. CT and MI results. The ectopic ACTH syndrome diagnosed with a rapid progression, less typical Cushing's symptoms, more symptoms from the tumor itself. Blood ACTH is even higher. Cortisol cannot be suppressed by low-dose DX images. The differential diagnosis: simple obesity. The same obesity, middle central obesity, menstrually disorders, abdominal stress, acne, etc. UFC can be increased. Different cortisols, circadian rhythms ejected. The asbestos can be suppressed by low-dose DX. Differential diagnose type 2 diabetes mellitus. Same. They have the same hypertension, obesity, IGT, high urine cortisol. Different diabetes mellitus without Cushing's syndrome's clinical manifestations. Cortisol, circadian rhythms exist. The alcoholism's 酗酒 the same, similar symptoms, high blood and urine cortisol. Difference: the alcoholisms stop drinking for 1 week. The biochemical abnormals will disappear. It can be suppressed by low-dose DX. Gloomies, the same, high urine cortisol. Different without clinical manifestations of Cushing's syndromes. It can be suppressed by low dose of DX. This is the step of diagnosis. If you suspected Cushing's syndrome, as the primus contains urine-free contents, the low-dose dexamethasone suppression takes 2 mg days in 2 days. If the patient less than 50% reduced from basis, it can be Cushing's syndrome. If greater than 50% reduced from basis is normal. If Cushing's syndrome, it can be the causes high doses dexamethasone suppression test. Every day eat 8 mg in 2 days. If less than 50% reduced from basis, it is adrenal disease, ectopic ACTH syndrome. If the greater than 50% reduced from basis, it is primus ACTH, probably Cushing's disease. The pituitary adrenal impacts the larger DST text. If the pituitary tumor can be suppressed. CT or MI is the tumors. Adrenal CT is the middle premise. ACTH is the higher. Ectopicus, the chest CT is the abnormals. Okay, the last treatment. Pituitary Cushing's disease is can schedules. Radiotherapy, drugs. If the adrenal adenomas or carcinomas, it can surgery. Ectopic ACTH shingles, surgery, and radiotherapy and chemotherapy. Drugs. That's the drugs. It can be used glucocorticoid synthesis inhibitors. Is the mitotrans. Material powers. Ketoconazole. Look at the picture. It's the hypothalamus stimulus CRH, and it can be surgery, radiations, drugs. Pituitary is surgeries, transvenously microsurgeons, radiations. In near a celebrate. Adrenal is can judges or surgeons. Okay, that's all the is there 3 questions to you. The first, what's the difference between Cushing's disease and Cushing's syndrome? The second question, how to discriminate normal and Cushing's syndrome? The third question, how to discriminate Cushing's syndrome caused by pituitary adenoma and adrenal tumors. Okay, that's all. Class is over. Thank you.